Hello dear students, welcome back again to Chinmoy's YouTube channel. So after a nervous system, we are back with a new episode of health and hygiene. So today we will be going to study the first part of health and hygiene, and I have divided this topic into two parts. So let us start with today's episode of health and hygiene. So what are the learning objectives of today's lesson? So at the end of this lesson, we will know that what is health. So definition of health, definition of hygiene, what are communicable diseases and why are they called communicable diseases? We will be knowing that. And after that, we will know that what are their causative agents, what are their symptoms, and what is the mode of transmission of these diseases, and what are the methods of prevention. So we will be knowing about the four things, like the name of the communicable disease, the causative agent, the symptoms, the mode of transmission, and the method of prevention of these diseases. So in the next part, we will be studying about the vaccination, immunization, what is vector and all. So dear students, please do subscribe to my channel if you want to know regarding this lesson. Not only this lesson, if you want to know regarding the other lessons also as per your ICSE curriculum. And before your final exams, I'll be doing the revision of all the lessons with a questionnaire pattern which you will be getting in your final exams. So let us start without delay today's episode of health and hygiene. So first here we are going to define what is health. So health, what is health? Health is a state of complete physical, mental and social well-being, and is not merely an absence of disease or infirmity. So it is a state of complete physical and mental and social well-being. Now, what does it mean that being healthy? So he is a healthy person. If we are telling that he is a healthy person, means that he is in a state of complete physical, mental and social well-being, and he is not carrying any disease or infirmity in his body. And it includes three phases actually: physical health, mental health and social well-being. So if these three states are all in proper state or balanced path, then only we are telling that a person is a healthy person. So what is a disease? Now a person is said to suffer from a disease when the normal, we can say that when the normal structure or function of their body is harmed. So he is suffering from a disease if there is any deformity, if there is any problem in any part of the body, that is, it is harmed or weakened. Any part of the body is harmed or weakened and it does not work properly. So any part or any organ or anything in the body is not working properly if it is harmed, or it is a person is suffering, said to be suffering from a disease. So in other words, what we can say that any physical or functional change from a normal state that causes discomfort and disability or affect the health of a person can be called a disease. So any physical or functional change, so from a normal state, if there is a diversion, if there is a disability that is affecting the health of a person, it is called a disease. Now there are two types of diseases. We know that one is the communicable disease and another one is the non-communicable disease. Now let us first stress on the communicable disease. So what is a communicable disease? Communicable disease are diseases that can be passed on from an infected person to a healthy person through contact. So as the name suggests, communication or communicate, we means to pass on to one person to another. So it is passing from the infected person to a healthy person and through contact with air, water, food or any other organism. So that is the communicable disease. Now communicable diseases are also called the infectious diseases. Why? Because these are caused by certain microorganisms and such as bacteria, virus, fungi, protozoa or worms. So these are also called microorganisms. So microorganisms that cause these diseases are called pathogens or germs. Is it clear? So the microorganisms which are causing these diseases are called pathogens or germs, and these are communicable diseases passed on, or these are caused by the microorganisms such as bacteria, virus, fungi, protozoa or worms. So we will now take each example of the common communicable diseases, and we'll start on discussing with the causative agents and the mode of transmission, symptoms as well as prevention. Now the first communicable disease which is very common everywhere, so that is the influenza. So Influenza is the first communicable disease. So it is caused by myxovirus. So what is myxovirus? It is a group of virus. So what is myxovirus? It is a group of virus, and it is causing influenza. Now influenza, what is the mode of transmission? Mode of transmission of myxovirus, this is the droplet infection through coughing, sneezing and spitting. So if a person is sneezing, if a person is coughing or spitting, through those droplets it is uh, passed on from the infected person to the healthy one, right? So what are the symptoms? So in influenza, people are having sudden fever with headache, sore throat, muscular pain, coughing and sneezing. So influenza symptoms, influenza, we all know that it is very common. It is a thing which seasonal changes and all, we are all suffering by this myxovirus. Okay, so what are the things we should do? How we can prevent this infection or influenza from spreading from one to another? We should keep away always from the infected person. We should cover our mouth and nose while coughing or sneezing. Is it clear? So this is a very common disease. This is a very common state of our body when we are infected by influenza virus. So these are all things which we can do to prevent ourselves, and these are the symptoms. Now next comes measles. Measles also, it is caused by the paramyxovirus. It is also a virus. How is it passed on from one to another? This is also through droplet infection, through coughing, sneezing and spitting. Now sore throat and runny nose, watery eyes, dry cough with fever, small whitish spots appears on the inner walls of the cheek. So red rashes appear first in the neck region and then the whole body. So these are all the symptoms, right? So measles, we can say that within a week or 7-8 days, the rashes they fade away, leaving the brown color spots on your skin. And what is the prevention? Generally MMR vaccine, mumps, measles and rubella. This is the vaccine name. MMR vaccine is given to a child at the age of 9 months and 15 months. So it is given twice. So the first one is given at the age of 9 months and the booster dose is given at the age of 15 months. Okay, is it clear? So this vaccination, this methods of immunization we will be studying in the next part. So please stay tuned with all the lessons which I am posting. You will get it clear. So 9 months and 15 months they are being given the MMR vaccine. And what is another thing we can do? We can keep the patient isolated for 10 to 15 days. So this is the vital time when the virus spreads from the infected person to the healthy individual. So this is all about the measles. So let us move on to the next one. Now comes malaria, right? So malaria is caused by a protozoon. So this is called the plasmid. It is actually of the Plasmodium species. It is a protozoon. Now, what do we all call these microorganisms which are causing diseases? So all these microorganisms which are causing diseases are called pathogens or germs. Okay, so whether it is bacteria, whether it is a virus, all these microorganisms are called pathogens or germs. So these germs or pathogens are the microorganisms which are causing diseases and which are infecting the healthy person from the infected person. So how this malaria is caused? Malaria is caused by the Plasmodium species protozoon. It is caused by an infected Anopheles mosquito. So through this mosquito it is transmitted from the healthy to the from the infected to the healthy one. So parasites, they multiplies in the red blood cells and destroys them. And alternate phases of chill and high fever, they repeatedly in a day of 3 to 4 days it keeps on coming. So these are the symptoms. So high fever and chill, it comes and goes repeatedly and it stays for 3 to 4 days. And other symptoms are severe vomiting and headache is there. The fever subsides with profuse sweating. Whenever fever is there, whenever they are given a dose of paracetamol, it subsides with a profuse sweating and there is a severe chill in malaria patients. Now how we can prevent this disease? Now prevention is actually we should prevent ourselves from getting mosquito bites. So it is very common, we all know that we should keep our surroundings clean, we should use mosquito repellents, we should use mosquito nets and all. And taking if these are all the preventing things: spreading insecticides, oil all over water, using mosquito net, and sleeping while sleeping, and mosquito repellent cream and ointment. Now if a person is having malaria, what to do? So the prevention phase is over, right? He couldn't prevent malaria. So when he had malaria, what he can do? He can take the anti-malarial drugs such as chloroquine and all. So this is all about how we can prevent and what are the things we can do when a person is already having malaria. So next one, same mosquito bite, another thing is there, that is dengue. So let us move on to dengue. Now we are here back with dengue. So what is dengue? It is caused by barbovirus only. So it is also caused by a mosquito called Aedes mosquito. Now what are the symptoms of dengue? So as compared to malaria, the symptoms will be the same in dengue. It is having high fever with severe muscle and joint pain. Behind the eyes, the pain is severe. Nausea and vomiting is also there. And in malaria, no red colored rash was there, but here red colored rashes are over the skin from the 4th to the 6th day of infection. Now here the platelet count, the main thing happening is the platelet count is going down considerably below as 20,000. So what is the normal platelet count? So the normal platelet count is actually we can say that 1,50,000 to 4,50,000. So this is the normal platelet count. So this may be the minimum and this may be the maximum. So this platelet count per microliter of blood. So per microliter of blood, this much platelet should be there. So that level falls to 20,000 only per microliter. So it is a drastic fall in platelet. So why this platelet count is dropping? In dengue. So what is this fall called? What we can say that the sudden drop in platelet count is called the thrombocytopenia. This is called thrombocytopenia. So what is it? Actually, this is the destruction of the platelets by dengue virus, and the virus, it is infecting and damaging the bone marrow. So platelets are produced in the bone marrow. So platelets are produced in the bone marrow. Is it clear? So they are produced in the bone marrow. So the virus is affecting the bone marrow and it is damaging the platelet production and leading to the less production or decrease in the production. Now sometimes in some cases we can say that the immune system, that is the antibodies, they also attack the platelets and they destroy the platelets. That is a rare condition. That also happens, that the immune system is attacking the platelets and they are destroying the platelets. So due to this rupture or due to this destruction of these platelets, there is a condition, that is bleeding of gums, bleeding of nose, and bruising happens, because these platelets are always helping in the blood clotting process. Okay, so in the blood clotting process, the platelets are helpful. So as there is thrombocytopenia, or there is a decrease in the platelet count, there is bleeding from the skin, bleeding from the gums, nose and all in this dengue, and it is a really fatal condition. If the platelets drop down to very low condition, if it is not attended properly, then we can say that it can lead to death also, dengue. So blood clotting is not happening there. It is a severe bleeding will be happening in the organs, and that will lead to death of the person also. And what are the prevention? So prevention will be the same as that of malaria. We should prevent the breeding ground of mosquitoes. We should use mosquito repellents and all. And in case if dengue has happened or you have tested positive for dengue, you should go to the doctor, take medicines, and you should be attended properly by the physician. Okay, so these are all about this dengue. So let us move on to the next mosquito related disease, that is chikungunya. Now here chikungunya, the next disease which is caused by mosquito, is there. It is caused by CHIKV virus, and it is a virus of alpha group, and Aedes mosquito is the cause of this disease. And what are the symptoms of this disease? It is having high fever, muscle pain, and joint pain is very often severe and can last for a few weeks and months together. Okay, so this is all are the symptoms of chikungunya, and they are all mostly similar to that of malaria and dengue. So here also headache, nausea, fatigue and rash will be there, and these symptoms often they are confusing us with that of dengue. Okay, so these symptoms are same as that of dengue, and prevention, how it is prevented. So it is same as before. So we have already discussed the methods of preventing ourselves from mosquito bite. So same as before. So this I'm not discussing again and again. It is same as before. So go through the previous slide and just check it. Now the last one is the acquired immunodeficiency syndrome, or AIDS. So this is also, we all know, it is caused by human immunodeficiency virus, HIV. That is, the name of the virus is HIV, and the disease is called the acquired immune deficiency syndrome. So that is AIDS. So acquired immune deficiency syndrome is the disease, and the virus which is causing the disease is called the human immunodeficiency virus. Now, exposure to infected blood through cuts, wounds, and sexual contact, organ transplant, blood transfusion, and mother to child. These are the ways it is transmitted from one infected person to another. So, if you are sitting close to an AIDS person, you'll not have AIDS. It should come through the infected blood. So, blood is the only source. So, blood can come in contact, infected blood, through cuts and wounds, through sexual contact, through organ transplant, through blood transfusion, and from a mother to child. Another thing is that, another problem is that it can it is actually, what is it causing? It is breaking down the immune system. So immune system of our body is fully broken down, and it is causing severe weight loss. A person feels fatigued, and having persistent dry cough, rash, and shortness of breath. So there will be a headache also, because the person is weak. Visual disturbance might happen, gastric problems or irregular diarrhea might happen. There are several diseases like lung diseases, like pneumonia can also happen, because it is destroying the immune system. Now a person is susceptible to infections, all types of infections he will be susceptible to, because it is you're disturbing the immune system. So it should be, a person should be susceptible to is susceptible to all types of infections. So how it is prevented? It should, screening should be done before blood transfusion, avoiding sharing and reusing of blades, needles, syringes, surgical instruments, avoiding pregnancy if the mother is HIV positive, and having safe sex, and educating people from this disease. These are all required very much. Now, another thing we can say, that these are the main communicable diseases which we have discussed here. Apart from this, there are several other communicable diseases also. Another disease, it's very common, we can say that swine flu. We hear it, it is same like the influenza only, and it is caused by H1N1. It is caused by H1N1 virus. Okay. So it is called the swine flu, and is caused by several types of swine influenza viruses. So it is also a respiratory upper respiratory tract disorder, and it is infecting the cells of the deep cells of the lungs. So what is it causing? It is causing pneumonia. It is causing pneumonia, and it is destroying the cells of the upper respiratory tract. Okay, so is it clear? Cells of the upper respiratory tract. So this is also another disease which is caused communicable disease. Now, if severe pneumonia is happening, it can cause death also if it is unattended, or if it is not attended properly. So this is all about the communicable diseases. Mostly we have discussed as per your syllabus. So there are many other diseases, communicable diseases. So in higher classes you will be studying that. But in 8th standard, this is all for today's class. In the next class, we will be studying about the vector, what are vectors, how the prevention of the diseases can be done, what is vaccination, what is immunization, and what are the basic principles of immunization. So please subscribe to my channel, stay tuned, stay updated with all the lessons which I am posting, and please do share it with your friends, so that whatever I am teaching, it should reach your friends also who are there in 8th standard. And as I am teaching 9th and 10th also, please do share with your friends of 9th and 10th ICSE also. Thank you.